This video demonstrates the correct way to set up Ballard 24-hour oral care kits, and how to operate the cleansing and suctioning tools with the suction handle. This video may be used if your facility uses a Q2 or Q4 protocol, or a protocol that includes the use of CHG. Ballard oral care kits are complete with everything needed to provide comprehensive and consistent oral care, recognized as critical for preventing VAP by the CDC and AACN. All Ballard 24-hour oral care kits are designed to be kept at the patient's bedside. The kit can be hung on the wall with hangers provided by AirLife or kept on a flat surface such as a table or shelf. Ballard oral care kits come in a Q2 or a Q4 format, both with and without CHG. A mini kit, as well as oral care kits for non-ventilated or oral care dependent patients. AirLife offers a variety of swabs, available in a variety of packaging configurations. To start using the Ballard 24-hour oral care kit, first remove the perforated box top during the 24 hours in which the kit will be used. Work your way left to right, using each of the easy-to-use components. Component packs are color-coded to match the order of use guide on the back panel of the kit. Follow your facility policies to start using the kit. To start using the kit, remove the dark blue prep pack from the box. The prep pack is identified by a dark blue stripe on the top of the pack. Peel open the prep pack. Attach the Y connector to a suction canister if needed. Once connected to suction, check to ensure the suction is working properly. Next, attach the suction handle to suction and attach the oral care yankower to the suction handle. Provide 1/4 turn to secure the connection. The suction handle attaches to all components in the kit in the same manner. The on-off switch controls the suction. Remember, the dual-piece yankower and suction handle will be used for the duration of the 24 hours, and should not be thrown away during kit use. Open the purple suction toothbrush pack. Remove the yankower from the suction handle and set it aside. Attach the suction toothbrush to the handle, performing 1/4 turn to secure the connection. Dip the toothbrush into the solution cup. Brush for 1 to 2 minutes, while suctioning often. Remember, if you were using the kit with CHG, the cup is located on the side of the box. The toothbrush pack also includes an oropharyngeal suction catheter which can be used as needed. To use the suction catheter, attach it to the suction handle, performing a 1/4 turn to secure the connection. Suction and clean the oropharyngeal cavity. Disconnect the suction catheter from the handle and discard it. Reattach the yankower to the handle and suction any excess fluids. Next, remove the applicator swab from the component pack and coat it with a mouth moisturizer. Apply the moisturizer to the patient's mouth, and apply a thin layer to the patient's lips. Discard the toothbrush and swabs. Depending on the kit in use, the order of use guide helps simplify the process. Follow your hospital protocol and procedures for specific guidance on when to perform the next oral care procedure. Facility uses a Q2 protocol. The next pack to open will be the light blue suction swab pack with alcohol-free mouthwash solution. If your facility uses a Q4 protocol, the next pack to open will be the green suction swab pack with hydrogen peroxide solution. The only difference between the packs is the solution contained in them. Use a suction swab pack. First, open the pack, remove the yankower from the handle. Attach the suction swab to the handle, performing 1/4 turn twist to secure the connection. Dip the swab into the solution cup. Swab the mouth while suctioning often. Disconnect the suction swab from the handle and discard it. Reattach the yankower to the handle. Apply the mouth moisturizer to the applicator swab provided, and apply moisturizer to the patient's mouth and lips. Discard the applicator swab. Repeat these steps for your hospital protocol and procedures so as to use all the component packs provided in your comprehensive Ballard 24-hour oral care kit. With the easy-to-use color-coded packs provided in the Ballard 24-hour oral care kit, your staff will be better prepared to help address the risks of VAPs in your oral care dependent patients.